helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1 Love Music, Love Life. You are tuned into Smooth Health on the Drive. We are they're about 13 minutes late there. Apologies. They're trying to get a hold of our doctor, but he's right here. So you're welcome to Smooth Health on the Drive, brought to you by Evercare Hospital. My name is Judith TV. Our guest today is here with us. He joins us live via Zoom, and we are going to be discussing something that everyone seems to be doing at the moment, and that is coughs, knowing when it's sinister or nothing to worry about. And to guide us in this conversation, we're joined by Dr. Kunle Iroja. Doctor, good afternoon to you and welcome to the show.
Good evening.
Good evening,
nice
Doctor.
To be here.
I've been in this box since 3 p.m., so apologies, bear with me there, Doctor. So, Doctor is a consultant physician, and he received most of his professional training at the University College Hospital, Ibadan. He obtained his MBBS certificate at the College of Medicine, University of Ibadan in 2006. And so far, so good. He has developed keen interest in less conventional areas of pulmonology, such as sleep medicine, lung disease areas, and the likes. It goes on. He's also worked extensively with drug-resistant tuberculosis program, which UCH pioneered in Nigeria, as well as with the National Tuberculosis, Leprosy, and Buruli Ulcer Control Program. Dr. Kunle Iroja is a driven, focused, and dedicated respiratory physician committed to the philosophy that globally improved healthcare is achieved by the multiplication of individual effort. Now, he joined Evercare Hospital and is poised to push the boundaries of respiratory medicine in Nigeria. And so he joins me today to discuss coughs, knowing when it's sinister or nothing to worry about. And you want to join the conversation today. Now, to be part of the conversation, please just send us a WhatsApp message to 0809-444-0981. That is our WhatsApp number for you to join the conversation. Again, 0809-444-0981. That's our WhatsApp number. You can also call us up on 0144-89981. Now, Doctor, let's start off, shall we? So can you please tell us what a cough is? And also, let's just start with the basics. Also, how to identify the various types of coughs.
Okay. So, coughs are one of the most common symptoms in existence. Like, practically everybody at some point in their life will have a cough or have coughed. Everybody. I don't even think there's a human being alive unless they have a problem that doesn't experience coughing. So what exactly is a cough? It's like one of the body's mechanisms for protecting the airway. It's the way the body gets rid of harmful substances. Let's say you eat and it goes down the wrong way. The cough reflex helps to get it out of you. Similarly, when you have an infection, your lungs get filled up with yucky stuff, and a cough helps to expectorate those things, to get it out, right? So coughs are natural mechanisms, defense mechanisms for the body. However, coughs are also symptoms of worsening disease or symptoms of abnormalities in the lungs and the upper respiratory tract.
Great.
So the challenge, of course, for most people, like I said, everybody experiences cough. How do you now tell when, I just have a cough and after a few days it will go, which is majority, 90% and more of what people experience. And the cough starts, if you don't do something about it, the outcome will be very negative. Okay?
Yeah. All right.
So, go ahead.
Yeah, I wanted to ask what the causes of this cough and the risk factors of a cough.
Okay, so coughs generally, the causes are myriad. You have things like infections, which could be minor things like a viral infection. Some viral infections are not minor, like we have with the COVID pandemic right now. It's another cause of cough. Tuberculosis in this environment is a very, very common cause of cough, and one that is frequently overlooked, and which the government is trying very, very hard to bring everybody to have it in the forefront of their minds, because it's treatable. But if you leave it alone, it has very terrible effects on the body. Then other things, fungi can cause cough. Last year they were talking about black fungus in people that have had COVID. So fungi can cause cough. Even parasites. You have some things they call lung flukes, which are like worms that infect the lung and cause damage, right? They have one of the most worrisome causes of cough is cancer. It's a very frequent cause of cough, lung cancer. So people with lung cancer, they tend to cough. They tend to be a bit older, and they tend to be smokers. Other things include asthma, very overlooked. People that have a chronic cough, especially young people, it could just be asthma masking or masquerading as a cough, right? So you would have very poor health and just poor life experience with this persistent cough that's embarrassing you up and down, and it might just be asthma, which is easily treatable. Then there's another disease that we call COPD. It's another disease caused by smoking, and it leads to coughing. And other lung diseases, maybe inhalation of toxic elements from your workplace and whatnot, those can also cause coughs. Okay? Those are the most common causes of cough in our environment that are just that we are most important to us as respiratory physicians.
All right, so let's take it further now. First, tell us, how long should an individual be coughing before the person is required to see a doctor?
Right. So, two things to note. When you're coughing, most coughs are dry. Then there's some that are wet. If you have a cough of very short duration, especially dry coughs, typically 3 to 5 days, no issues. But if you feel that, if you notice the cough extends beyond 5 days, 1 week, 2 weeks, definitely you should see a physician. If anybody has been coughing for more than a week, the person should see a doctor, right? Then if you have any unusual production from your cough, let's say you have creamy sputum or yellow sputum, it would be in your best interest to see a doctor sooner. Maybe at least 3-5 days you're still coughing, you have a fever, and you're producing sputum that is very colored, you should see a doctor. If for whatever reason you're coughing up blood, and it's not just a streak of blood on one random occasion, and you're persistently coughing up blood for whatever reason, for whatever duration, one day, you should see a doctor.
All right, great stuff. So what are the signs of a cough that may maybe signal something more serious than just a viral infection?
Okay. So like I mentioned, if you're coughing up blood, so common causes of coughing blood, tuberculosis, lung cancer, and those are two serious illnesses that the prognosis is much better when they're caught early. So if you have any of those two, you must go to the hospital as soon as possible. If you have coughing of blood, you must go to the hospital as soon as possible. If you're coughing and you are breathless, you should go to the hospital immediately. If you're coughing and breathless, in the COVID pandemic, that is one of the key signs of COVID-19: breathlessness, cough, then others like fever, loss of smell, loss. So if you're coughing and breathless, you should seek health advice. Okay? If you have a cough and chest pain, it may be wise to see your doctor. So those are the main things that signal typical viral coughs. You don't have pain, you don't have breathlessness. So if you have any of those symptoms, you should see the doctor as soon as. So those are signs of more serious disease.
All right, great stuff. You can join the conversation. Send us a WhatsApp message to 0809-444-0981. If you have any questions for our guest today, again, 0809-444-0981. We're talking about coughs today, and this time, what to know, or just knowing when it's sinister or nothing to worry about. And that's what we're talking about. We have Dr. Kunle Iroja here with us. He's from Evercare Hospital, and of course, Smooth Health is brought to you by Evercare Hospital. We have a question here from Obai, and it goes, hello, I have a question for doctor. How helpful are cough syrups, and are there different types? And that's from Obai there.
Okay, so cough syrups, there are different types of cough syrups. You have cough syrups that help you to expectorate. So when you have chesty coughs and coughs that have a lot of mucus within your chest, people tend to use expectorants to help clear their chest. And then you have the syrups that help suppress coughs. Those are typically more useful for myself. You want patients that are coughing a lot. You might need to suppress it because you can have side effects on coughing, ranging from pain to even hernias from coughing too much, right? However, I'm not a fan of cough syrups. What tends to happen is that people use cough syrups and then they keep using them. You have a cough for 1 week, you're using cough syrup. 2 weeks, you're using cough syrup, and you keep using, rather than actually finding out why you are coughing. It will be better to treat the underlying cause of the cough rather than just dosing yourself on cough suppressants. So I'm not a big fan of cough syrups, but from on occasion we use them. And of course nowadays some of the cough syrups are even banned in Nigeria because of drug addiction, like codeine cough syrup, which were very, very useful. But now they're no longer in the market because of drug addiction.
You can join the conversation. If you have any questions, please, we will welcome them. Send them to our WhatsApp platform, 0809-444-0981. And that is the WhatsApp number for you to send us questions. So now we just finished talking about treatments and, different cough syrups. And we talked about, when it signals something more serious than a viral infection. But what kind of, can you please tell us, some natural home cough remedies that's available, some that seem to be available or that you would recommend, natural or home cough remedies?
Okay, so natural remedies, one that works well is honey and ginger. Honey is a very good antibacterial agent, and it's been used forever for treating coughs. Just a teaspoon of honey in hot water and drink it. It works wonders for a lot of all these throaty coughs. Ginger as well, it also works wonders. Then even steam inhalation, it helps to decongest the nasal cavity, which might be what's triggering coughs in some people. So that tends to help, especially if just a day or two of some dry hacking cough. You can try some steam inhalation, put some eucalyptus inside. My mother swears by that thing, and it helps to clear up the cough a little bit. Again, these should only be used for a few days before seeking more advice, because you may just be masking a more serious condition.
That is very, very, very true. Now, I know that he's asked about cough syrups, but what kind of cough medicine or syrup would you recommend for a person with a cough?
Well, it depends on the type. So, if someone is coughing, let me put it like this. The only reason I recommend a cough syrup to people to take at home would be if you have a cough that's embarrassing you. Maybe you have an important interview and you have to be somewhere and you don't want to be coughing up and down. I would advise a cough suppressant. There are different types. I don't really want to mention brands because I don't think it's to be appropriate, but we have a dextromethorphan, a cough syrup. It helps with suppressing coughs. So if you have maybe some reason that you just don't want the embarrassment of coughing, but remember, that is treating a symptom. It doesn't treat the cause of the cough. It's only so that you won't be coughing. but it's not treating whatever is making you cough. Okay?
All right, great stuff. We have a message here. This is Tunde from Ikeja, and is asking that he's been having a cough for days now, and it only in the middle of the night does it come out with some sort of muco discharge. And he's asking what it is, and is also asking, please, is there a herbal remedy that he could try?
Okay, so now cough in the middle of the night. Again, it might be difficult I can't diagnose it without actually seeing the person, but common causes that might occur in patients that lie down. Maybe when you're sleeping, you're lying down. It could be reflux disease, that is have heartburn and stomach acid comes back from your stomach, so you call it reflux disease. And that can, when you're lying down, the stomach acid comes up your throat and then goes the wrong way down your airway, and then you cough. So it can happen to people at night. So that's one cause. Another one, very common, asthma. Asthma tends to be more symptomatic in the early hours of the morning or late at night. And people might have cough and breathlessness as a wheezing as symptoms. So that might be a possibility. However, if it's been persistent for a long time, like I said, you should see a doctor.
Great stuff. Now let's talk about coughing in children, shall we? Let's tell us a bit about that. What causes coughing in children?
The most common cause of coughing in children is viral infections. You can have things like inflammation of the airways from a viral infection. We call that bronchiolitis or bronchitis. So those are usually what children have, right? It can get pretty bad. Okay, the other things like whooping cough and croup, those are some bacterial causes of cough. They have very distinct ways that they appear, but at least for whooping cough, there's a vaccine, so it's less common nowadays. However, they sound very, very strange. So everybody kind of knows what coughs should sound like. So if you start hearing abnormal sounding coughs, like something like a cow coughing, or your child is whooping, you cough, and then still cough. Those are really abnormal. They warrant going to see a pediatrician. Asthma is also very common in children generally, especially those below 5. They might be hard to make a diagnosis, and people will be coughing. Then sometimes, even rare conditions like maybe congenital problems, maybe heart diseases or congenital heart diseases or congenital lung diseases, especially in very young children like infants, they may cause cough. And so it's very important that parents watch their children very carefully and notice that, okay, this cough, it's a bit weird. He's turning blue in the face, or he's always tired, or he's not growing as well as he is, and he's always coughing. They must see a pediatrician. Okay?
Well, I have a question here. This is, although you didn't leave your name, sir, and it goes, thanks, doctor. What if someone who coughs longer but nothing comes out? What will you do or use? That's from, he didn't leave his name, but that's what I was asking. He said for someone who coughs longer but nothing seems to come out. That's a dry cough, I presume.
Yes. Now, it may be, there are lots of possibilities. He said longer, but he hasn't stated how long. Like, is it bouts of coughing that are long, or he's been coughing for weeks? Those are two very distinct things that might be longer. Again, if it's a short duration, perhaps you can use a cough suppressant if it's embarrassing you. But if it's for any long duration, if you've been coughing more than a week or 2 weeks, it is important to get it looked at, because you may be suffering unnecessarily. And there are many things that can cause a cough. So it's important that he has it looked at if he's been coughing for a long time. If it's just a short duration cough, I don't advise over-the-counter antibiotics, by the way. So if you've been coughing and it's not getting better, go see your doctor. Don't go to the pharmacy and just buy antibiotics, okay? Go see your doctor.
Another Obayi is back in. Obayi is back in. He's saying that he says here that I have a family friend who's on antihypertensives but has been coughing since she started her drugs. What can we do? And that's from Obayi there.
Okay, so another will I say common or the common cause of cough is medications, particularly what do you call this thing? A class of antihypertensive medication. They are notorious for causing dry cough. So if somebody develops a cough soon after starting antihypertensives, then it's likely the patient is on what's known as an ACE inhibitor, right? And the treatment for that would be to switch the type of antihypertensive to stop the offending one, and then use a new type of antihypertensive, and then see if the cough stops. That's usually the cause. So typically when we have seen a patient that's recently started coughing, we ask about what drugs they're on, and if we see anything that might be causing it, we stop it and change the medication. So that may be what's happening with these patients.
All right, so let's get back to treatments now, this time for children. What treatment options would you recommend for children?
Okay, for children, again, cough mixtures, I'm not a great fan. And I always look at kids as delicate. So I wouldn't recommend cough syrups for children. They can cough all they want, no problem. I wouldn't recommend cough syrups for them. So I would lean more towards going to see the pediatrician. People don't go to the hospital enough. That's the problem in Nigeria. Unfortunately, because of the cost of healthcare and the availability of quality healthcare, a lot of people don't go to the hospital as much as they should. If you have a cough for more than 3 days, 5 days, you should go to the hospital. But people would rather, okay, let me try this, let me try that, let me try this. If your child is coughing and the cough is having fever or looking weird, take him to the hospital. Take him or her to the hospital. If your child is coughing for any long period of time, more than 3 to 5 days, don't try too many home remedies. You can try the honey and ginger, but if it doesn't work, please go to the hospital. That's what I would keep on saying. And Evercare, we have fantastic pediatricians, so and we're not too expensive.
Now that you're there, tell us a bit about all the treatment options that are available at Evercare Hospital.
Okay, so at Evercare, we have a wide array of modalities for investigating and treating patients. We have CT scan, on top of the line CT scan machines, MRI. We have a full pulmonary function testing center, which is the only one available in Nigeria. Okay, we have bronchoscopy available, and all these are fantastic for investigating the cause of cough. This, again, nowhere else in the country has the wide array of investigative modalities that we have. So we can diagnose everything from cancers to asthma to COPD very easily. And treatment options, of course, we have them in abundance. We have fantastic cardiothoracic units. So even if it's a lung cancer, we have treatment options for that. We've done surgeries for patients with tumors. We do all sorts. So there's a lot available at our facility for treatment, investigation and treatment of various types of cough. Even if the cough originates outside the respiratory tract, like I mentioned with the reflux disease, we have endoscopy, we have all sorts. So Evercare is really, really poised to change the way we do things in this part of the world.
All right. Now, please tell us, how can, the good folks and everyone listening out there contact Evercare and also to you as well? So
with Evercare, we can contact the customer care directly. The number is 0813-985-0710. That's his customer care. You can make any kind of inquiry from the customer care. You can be put in touch with physicians, can make appointments and everything. Then also on the website, www.evercare.ng, we can from there, you can do a wide variety of things. You can make appointments. There's a patient portal for our registered patients where you can check your investigations and book appointments and look at and order reports and whatnot. So the two main ways that you can reach out to us, the phone number and on the websites.
All right, great. Now, remember that you can go onto the website. It's www.evercare.ng. Again, www.evercare.ng. You can also call them up on 0813-985-0710. That's 0813-985-0710. That's the telephone number. And also, you can email them. It's info@evercare.ng. Again, it's info. That's info. Right, at evercare.ng. The address is 1 Admiralty Way, Bisola Durosini Eti Drive, Lekki, Phase 1. Dr. Kunle, thank you so much for coming on the show today.
Thank you very much for having me.
All right, and that brings us to the very end of Smooth Health on the Drive. Stick around, great music on the other side. Smooth Health on the Drive. Stick around, great music on the other side. My name is Judith TV. This is Smooth Drive. Stay with us.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.